Hi there. I hope all of you are doing well. Today we are going to talk about the nurses in Canada. We are the group number 5 and the components of the members of this group are Elizabeth, Diana Rojas, and Laura Joaquin.
Hello, my name is Lisa de la Rosa, and I will be talking about the different degrees of nurse in Canada. In Canada, the practice of nursing is recognized as a complementary action of another health professional and not as practical support. In Canada, there are 3 degrees within the nursing profession, that is, the nurse generalist, registered nurse, and practical nurse. Nurse generalist. The nurse generalists are registered nurses who have 4 year college education plus a master's degree and that they passed the qualification examination. They are therefore empowered to prescribe medicines, diagnose, admit, and discharge patients, and carry out other activities. General nurses are defined as licensed nurses with the most education and experience, and who have and then demonstrate the necessary competencies to act autonomously in the diagnosis, requisition and interpretation of diagnostic tests, prescribing medication, and perform a specific procedure within its statutory scope of practice. Registered nurse. The nurse graduate have 4 year university education years. Registered nurse do not is authorized to prescribe medicines. Practical nurses. In the case of practical nurses, the period for their training is generally 2 years. Practical nurses do not is authorized to prescribe medicine. I go to read in Spanish. Ahora voy a leer en español. En Canadá, la práctica de enfermería se reconoce como una acción complementaria de otro profesional de la salud y no como un apoyo práctico. En Canadá existen 3 títulos dentro de la profesión de enfermería, es decir, las enfermeras generales, enfermeras tituladas y las enfermeras prácticas. Las enfermeras generales. Las enfermeras generales son enfermeras registradas que tienen una educación universitaria de 4 años, además de una maestría y que aprobaron examen de calificación. Están, por lo tanto, facultadas para prescribir medicamentos, diagnosticar, admitir y dar de alta a los pacientes y realizar otras actividades. Las enfermeras generales se definen como enfermeras licenciadas con mayor formación y experiencia y que tienen y demuestran las competencias necesarias para actuar con autonomía en el diagnóstico, solicitud e interpretación de pruebas diagnósticas, prescripción de medicamentos y realización de procedimientos específicos dentro de su ámbito estatutario de práctica. Las enfermeras registradas. Las enfermeras graduadas tienen 4 años de educación universitaria. Las enfermeras registradas no están autorizadas para recetar medicamentos. Las enfermeras prácticas. En el caso de las enfermeras prácticas, el periodo para su formación es generalmente de 2 años. Las enfermeras prácticas no están autorizadas para prescribir medicamentos. Gracias.
Hi, my name is Diana Rojas, and today I'm going to be talking about the education of nurses in Canada. Registered nurse, RNS, and registered licensed practical nurse through Canada study a diverse range of mandates such as including, but not limited to, psychology, anatomy, pathophysiology, epidemiology, microbiology, nutrition and dietetics, pharmacology, organic chemistry, nursing theory, and nursing skills. Extensive hands-on practical training, colloquially referred to as clinical by students, starts as early as year 1 and extends to graduation. Most provinces prefer that the registered nurse RN hold a bachelor degree, typically a Bachelor of Science in Nursing or Bachelor of Nursing. Registered Practical Nurse RPNS is a title applied to practical nurse in Ontario and Quebec, which is not to be confused with registered physiatric nurse, and are equivalent to licensed practical nurse in the other provinces and territories of Canada which favor this title. Uniquely in Canada, McGill University offers a direct entry master's degree, where applicants don't need previous education in nursing, achieving licensure as well as a NSC Master of Science. RNS can pursue future education at the master of or doctoral level, receiving a Master of Science in Nursing or PhD, respectively. Additionally, there are several different types of master degrees. Depending on profile of study, the RN can choose to study to become a nurse practitioner, an advanced practice nurse, a registered nurse first assist, surgeon assistant, in addition to many other fields of study. Registered nurse with university prepared education interested in advancing their studies or practice may choose to study to become physician assistant at a faculty of medicine in Canada. This nurse may decide to study in this area instead of becoming a nurse practitioner. The physician assistant profession is based more in the medical model, which is similarly modeled after physician education, with theories and practice related directly to medicine. The physician assistant profession is not directly related to nursing. Nurses may pursue this area for a desire to learn the study of medicine in depth and to practice medicine. Thank you so much and have a good day.
The book that we were studying from was the one of Cambridge of UK, and then there we were talking about like the support workers that exist. Also in Canada, they have clinical support workers which have done courses to obtain basic or low qualifications that can allow them to work on the hospital, like assistants and things like that. For example, they have nursing assistants or auxiliaries, and for like to be a nursing auxiliary there in Canada, the requirements are completion of a vocational college or other approved program for licensed practical nurses, and the registration with a regulatory body is required in all the provinces and territories as well. The specialization there are many specializations that a nurse can have. For example, here I put some of 10. It can be cardiovascular nursing, gastroenterology nursing, rehabilitation nursing, neuroscience nursing, psychiatric and mental health nursing, oncology nursing, pre-anesthesia nursing, hospice palliative care, enterostomal, community health nursing, critical care nursing, perioperative, perinatal, orthopedic, medical surgical, emergency, critical care, gerontological, occupational health, and nephrology nursing. The nurse's role in Canada and other countries, the nurses can perform procedures. For example, the nurses in Canada evaluate and record the patient's symptoms, also performing diagnostic tests. The nurses as well, they assist the physicians in medical procedures, like for example, the medical surgical nurses, they also prepare, there are some of them that prepare the area or help in some part of the surgery, or to prepare before the surgery, or the care that we need to take about with the patient when once they get out of the surgery. As well, they offer guidance to the family members. They lead public health education campaigns. This is another part of the nurses, even here in DR. Nurses do that as well. We try to promote the health, talking about topics, helping the communities, etc. As well, they treat medical emergencies such as heart attacks, strokes, car accidents, and burns. They also can help with the first aids for a patient. And as well, recovering post-operative patients, that was the thing that I was talking about. Once the patient get out of the surgery, nurses, they give the care that needs the patient. As well, they supervise the licensed practice nurses, the LPNS, and certified nurse assistants. And this is practically what I was saying is about the role of the registered nurses, the RN. But there are another ones that are, let's say, in a lower level, that they have to take care of them. Then that's it. Thank you so much for your attention. I hope that was good information for you and you could learn from it. Bye bye.